Welcome to the Deep Dive. Really glad you could join us today. We're about to get into something that, well, it really affects everyone. Our mission here is to tackle these really complex, interconnected public health challenges in the U.S. for 2025. We'll be pulling apart this new analysis. It's called America's Health Crossroads, Crises and Choices in 2025. And we want to pull out the biggest concerns, maybe some surprising facts, and, the issues underneath it all. Okay, let's unpack this.
Yeah, and what's really insightful, I think, is how this analysis frames it. It argues these aren't just like separate problems on a list. It really shows this intricate web, how these different health challenges are deeply tied together. They reflect these deeper societal currents affecting our well-being.
That interconnectedness, that jumps out right away.
Yeah.
And the report starts with something pretty heavy, doesn't it? This silent struggle, the mental health crisis. We hear about anxiety, depression. But this analysis shows a really alarming acceleration, especially among teens and young adults. Suicide rates, too. What did the report say were the surprising drivers? I mean, beyond the ones we might expect.
That's a really good point. Okay, so economic uncertainty, political instability, yeah, they're in there. But what really stood out to me was the focus on climate anxiety. The analysis actually found a measurable increase in distress linked directly to fears about the environment, especially in younger people. And it also tries to quantify the impact of, social media overexposure. It shows a correlation, basically, between lots of screen time and feeling isolated or inadequate. So it's drilling down into these specific modern stressors.
Climate anxiety linked directly to mental health stats. That's something. And crucially, the report hits hard on this huge barrier. Limited access, unequal access to affordable mental health care. It feels like the problem is just speeding up faster than the solutions.
That's a very fair assessment, unfortunately.
And, as the analysis links mental well-being to these societal pressures, it also points out how these pressures show up physically. I'm talking about the rise in obesity. The numbers are, huge. Over 42% of U.S. adults now.
Right. It's a massive number.
But what's the report's deeper angle on this, beyond just the percentage?
Well, the deeper takeaway is this cascade effect. The analysis clearly shows it's not just about weight itself. It's a primary driver for this explosion in other serious conditions. We're seeing a surge in type 2 diabetes, worsening heart disease rates, and a really concerning rise in non-alcoholic fatty liver disease, and often in younger people than we used to see.
And the report does point to the usual suspects, right? Poor diet, not enough movement, food insecurity playing a big role.
Yes, absolutely. Those are foundational issues.
But then it adds this interesting layer, talking about these new weight loss drugs like Ozempic and Wegovy.
Exactly. And that's a complex point, because while these drugs are a medical breakthrough, no doubt, the analysis immediately asks, okay, are these widening the health gap? It flags real concerns. Long-term safety isn't fully known yet. The out-of-pocket cost is substantial. And critically, will they actually be accessible to everyone who could benefit?
Or just another thing for those who can afford it.
Precisely. It raises the concern that this kind of innovation, if we're not careful about equity, could actually make existing divides worse.
That's a really sharp, crucial point.
Yeah.
Okay, so from what we eat and how we live, let's shift to something we all share, the air we breathe. The analysis spends quite a bit of time on environmental health, arguing climate change is directly worsening air quality.
Yeah, and if we connect this to the bigger picture, it's not just abstract. The report has some stark numbers. It shows how wildfire smoke, general pollution, they're dramatically increasing risks for things like asthma, COPD, chronic bronchitis. What jumped out at me was the finding about high smog days. They found a clear correlation with a significant spike, sometimes up to 20%, in ER visits for breathing problems.
20%, wow.
Especially in polluted urban areas. That's a direct, measurable health impact right there.
Yeah, that really brings it home, doesn't it?
Yeah.
And speaking of strain on systems, the report also digs into demographics, the aging population.
Oh, absolutely.
Over 17% of Americans are now over 65.
And this shift, it puts just immense pressure on, everything, the whole healthcare infrastructure, hospitals, sure, but also long-term care, nursing homes, and especially individual caregivers, often family members,
Right.
The analysis really talks about the economic and emotional toll on those caregivers. It's kind of an invisible crisis happening in many homes.
And for this older demographic, the report lists conditions becoming even more common.
Yeah.
Alzheimer's, arthritis, cancers.
Precisely. And then layering on top of those medical needs are these other challenges: persistent staffing shortages across healthcare, doctors, nurses, aides. Plus, healthcare costs just keep rising relentlessly. And those two things together create huge barriers. They limit access to timely, quality care for the people who need it most.
So more people needing care, fewer resources, higher costs.
It's a really tough equation, a double-edged sword, as you say.
Okay, beyond those big categories, the analysis also zooms in on some persistent challenges that are still causing major disruption. Long COVID, for instance.
Right.
Millions apparently still suffering from fatigue, brain fog, breathing issues, long after they were sick. What's the update there?
The report is pretty sobering on long COVID. It emphasizes the ongoing struggle. Treatment options are inconsistent. The research is still evolving, so there's no single clear path to recovery for everyone. It's often misunderstood, underaddressed, causing huge personal and economic strain.
Yeah, you hear those stories. And then the opioid crisis, still devastating. The report highlights how it's now dominated by fentanyl synthetic drugs, leading to these record overdose deaths that just keep climbing.
It's tragic. And despite a lot of effort, public health campaigns, distributing naloxone, harm reduction strategies, the analysis points to two stubborn barriers. One is the deep stigma around addiction. It just stops people from seeking help. And the other is a chronic lack of comprehensive treatment resources, especially, in rural areas or underserved communities. The crisis is still outpacing the response. And what's fascinating here, or maybe compelling is a better word, is how the analysis keeps weaving everything back together. It doesn't treat these as separate chapters. It constantly circles back to this one pervasive, underlying issue that makes everything else worse. Healthcare inequality.
Healthcare inequality.
Yeah. This fundamental problem, it's just woven through our society, and it ends up being the critical factor determining outcomes for way too many people.
So what does this all mean? I mean, the report spells it out pretty clearly, right? Access to good care depends massively on your income, your race, where you live, insurance.
Exactly, all those factors.
And that leaves millions without the help they need, making this inequality, like you said, the thing that amplifies every other crisis we've just talked about.
That's the core message, I think. The analysis hammers home this central theme. The nation is really at a crossroads in 2025, facing a critical choice. It's not just about tackling one problem at a time.
Right, and for you listening, that choice, as the report frames it, is whether we as a society really invest in health equity, in innovation, in prevention. Do we commit to leveling that playing field? Or do we just continue down this path of widening gaps and, frankly, crisis-level outcomes? So considering this incredibly complex picture, what does it mean for you to be well in 2025? And maybe what role can collective action or even individual action play in navigating this crossroads? So something to think about.